Alright, this is chapter 11 in the insurance textbook. This chapter is fairly short. It's mainly a lot of guidelines to fill out claim forms. And so this chapter you will be filling out a lot of claim forms. At first we'll do some where I give you the codes, and then when you get pretty comfortable with that, then I will give you case studies and you have to figure out the code yourself. And then we'll start talking about, after this chapter, we'll get into how to fill out, if we have time, we'll get into how to fill them out for different insurance companies, because some companies may like to do theirs, a few different ways. So anyway, let's start on page 446. You have, I think, 6 or 7 key terms. You're going to need to know all of these. The billing entity, which is the insurance company. The diagnosis pointer number, and this is the linking aspect that we've been talking about. So, I think I've said the strep throat thing a million times in class, but if strep throat or sore throat links with a strep test, then in your strep, let's say strep throat or pharyngitis was number 1 in the diagnosis, then it would link to number 1 on your claim form. So that's what that is. Medigap, the NPPES, optical character reader or OCR. We have optical scanning and supplemental plans. So we're going to talk about all of these. Let's get started on page 447 and just talk about some general guidelines. We're going to talk about inpatient and outpatient guidelines. However, we're going to try to stick with office or outpatient because that's what most of you are going to be doing. So the first guideline, it says provider services for inpatient care are billed on a fee-for-service basis. And so each physician service results in a unique and separate charge, usually designated in a CPT book, but it can be in the HCPCS book as well. Number 2, appropriately report observation services. And it gives you a bunch of other stuff, but basically it tells you about observation care there, a well-defined set of specific clinically appropriate services, which include ongoing short-term treatment, assessment, and reassessment before a decision can be made regarding whether patients will require further treatment as hospital inpatients or if they are able to be discharged from the hospital. So you have to be careful when we're dealing with hospital coding with observation care. Number 3 on page 448, the surgeon's charges for inpatient and outpatient surgery are billed according to a global fee, okay, which means that one charge covers everything. Number 4, post-operative complications requiring a return to the operating room for surgery related to the original procedure are billed as an additional procedure. However, you would have to use a modifier after it, remember, because returning to the operating room for a complication during the post-op period is a modifier. Number 5, combined medical and surgical cases in which the patient is admitted to the hospital as a medical case, but after testing requires surgery, are billed according to the instructions in items 3 and 4. And then 6, we can talk about that. Some claims require attachments, and so just to be on the safe side, you may, if it's a case that you're not sure if your linking may be good enough, you may just want to send the form from the physician as well. So I'm not really going to test you on these guidelines. I just wanted to point them out to you. But let's look at number 7. This is where it does get important. For paper-generated claims, you have to be extremely cautious that the data prints in the spaces provided. So some people have, computer system, you can type it in and then print it out and it's fine. And then some people have it like typewritten where you have to line up the spaces and make sure that, everything is just so on the form. And so it can be, it can create a mess if they're not exactly aligned. And then, let's see, let's look at optical scanning guidelines. So optical scanning This is of paper claims, basically. And basically what it does is it uses like a scanner or a optical character reader, OCR, which are both of your terms. And basically what it's going to do is when you enter stuff into the computer, it will know what you've entered. It can tell what you've entered, and it can tell you, where it's supposed to go. However, most of the time, like for instance, if you put in the patient, has arthritis, a lot of the times it'll go ahead and assign a code, and you still need to check and make sure that everything's correct. So don't rely totally on that. OCR guidelines were established when the HCFA 1500, which is now the CMS 1500, or the claim form, was developed, and they're now used by everyone. It used to be used just by Medicare. Medicare kind of set a precedence for everyone to start using. Okay, so when we're doing case studies to put on these claim forms, all the data that's entered on the claim form has to be within the field. So most of the time we're going to start by writing. So obviously writing is easy. Then we'll go on the computer, which is still pretty easy, but you have to make sure it remains inside the field and not outside of the red lines. X's must be contained completely within the boxes, and no letters or numbers should be printed on vertical, solid, or dotted lines. So you'll have boxes that sometimes you may have, just the may just have a habit of checking, and you have to X the box, and no lines can come outside of the red lines of that box. So make sure you do that. Any kind of vertical lines or dotted lines, you shouldn't have any kind of writing over any of those, because that's going to mess it up. Flip on page 451. We have computer generated paper claims. Software programs should have a test pattern program that fills the claim with a bunch of X's, basically, and then you can test the alignment and realign if you need to. And then typewritten claims, you have to really make sure it's aligned, so you have to adjust constantly. So some of the guidelines here that are in your bullets there on page 451, you want to use Pica type, so OCR 10 is what you want to do. So a font of 10, basically. Enter all alpha characters in uppercase. So you pretty much need to have your caps lock on when you're doing this. Do not enter the alpha character O for a 0. Okay, so if you're doing $50, 5000, don't do 5 and then O. Make sure it's the number 0 and not the letter O. Enter a space for the following that are pre-printed. You want to enter space for the $sign or a decimal, the decimal point, and a diagnosis code number, and parentheses. All of those you'll enter space for if you're doing something that will be printed out onto a claim form. However, all the ones that we'll be doing, you don't have to worry about trying to, remembering when to space. You just need to remember when we get into more of the rules here. But you do need to know that everything needs to be in caps. Do not enter hyphens or spaces in the Social Security number, in the EIN number, or the plan ID number. Okay, so you do not enter hyphens or spaces. It's just all together. Enter commas between the patient or policyholder last name and first name and middle initials. So you do enter commas there. You used to not do that, but now they're saying to use commas. Do not use any other punctuation in a patient's or policyholder's name except for a hyphen in a compound name. So that's the only time you can use that. So example, Gardner-Bay, you can use that. Do not enter a person's title or other designation such as senior, junior, second, or third unless it's printed on the ID card. If it's not printed on the ID card, you cannot use it. Enter 2 zeros in the cents column. If it's $50, you cannot just put 50. It has to be 50, and then over here in the cents column, it has to be 00. Okay? Do not enter any leading zeros in front of a dollar amount. So if something was only, let's say, $9, You cannot put 09 and then 00. It's just 9 and then 00 for $9. Flip on over to page 452. It gives you an example and it shows you what that block looks like on your forms. You have 6 and then 00 behind the dashed line. Birth dates are entered as 8 digits with spaces between the digits representing the month, day, and the 4-digit year. Now, don't be confused on this, because when it asks you to enter the patient's birthday, it's only going to say YY for like a 2-digit year. However, you need to put the 4-digit year there, okay? Now, when you're going into the billing section at the bottom of it, you do only put the last 2 digits of the year. But when you're doing the patient's birthday, or anybody's birthday on the claim form, it needs to be a 4-digit year. Okay, so if it's January the 4th, you would need to be 01 for January, and then 04, and then let's say 1945. That's what it would be. All corrections to typewriter-generated claims must be made using permanent correction tape and should be typed or printed using pica type. You don't really have to deal with that because we're not going to be doing typewriter type things here. Handwritten claims. If we handwrite it, which you will be handwriting, it has to be legible. All caps, legible, neat. They have to be manually processed, so they have to be extremely neat, and the proper writing technique of letters. Extraneous data such as handwritten notes or printed material or any kind of stamps or anything like that should be placed on an attachment to the claim. Don't put notes out to the side of the claim, because that is only going to cause it to be denied. Nothing should be written or typed in the upper right hand corner of the claim. Nothing. So basically what you do is you have a name and address sticker for the patient that goes up there, and the sticker can go there if you want to, but usually we just don't put anything there. List only one. Let's see, I skipped one. The borders of pen-fed claims should be removed evenly at the side perforations, and the claim form should be separated. So let me just grab one for an example. These that I pass out in class, these are pen fed. You see they have the tiny holes on each side. So I'm going to pull one out. This one's already separated, but normally if it's not separated, I'm just going to remove it carefully and dispose of the pen fed part. Okay, and then usually you'll send one side obviously to the insurance company, and then we'll keep the other for records. I had these pre-printed, so it's only just one form here for the purpose of not wasting any extra forms. So just use this and just remove it before you turn it in. Remove the pen fed. Okay, going back to the second to last bullet there. List only one procedure per line, starting with line 1 of block 24. So if you get out or look online at a HIC or CMS form, you're going to look at 24. 24, it says do not skip lines between dates of services in blocks 24A through K. Alright, so this is 24A. Alright, and you're going to list the services 1, 2, 3, 4. So if, let's say today was a service day, I would put 04, 08, 13 for 13. Remember, that's the only time I do not use the 4-digit number, a 4-digit year. Okay, so you can use a 2-digit year, but the patient's birthday is a 4-digit year. Okay. And then you have, if you look in block 24, you'll have a from and a to date. If it's the same date, you do not have to fill in the to date. If you want to, there's nothing wrong with that. However, you do not have to do the to date unless it's more than one day that you're billing for. Okay, photocopies of claims are not allowed because they cannot be optically scanned. All resubmissions must also be prepared on an original claim form. In addition, information located on the reverse of the claim must be present, which if you flip this claim over, I think I gave one to you in class a while ago, you can see a lot of pre-printed information on the back of it. And if you look at the example, they do show you that they do a 4-digit year, but I'm thinking that may be a typo, because when you start getting on the computer, it's only going to allow you a 2-digit year. So right now, let's just go with 2 digits. Alright, and then we get to exercise 11.1, and I want you to do this, and we'll go over it the following Wednesday in class. But basically, you're going to get a blank sheet of paper, or you can write it in beside this, and write it in the correct technique. So for instance, Jeffrey L. Green, DDS. If I was doing that, I'm going to show you how I do it. I'm going to do Green first in all caps, and then I am going to use my comma and do Jeffrey in all caps, and a comma, his middle initial. And it says do not put that he's DDS or the third or the second or whatever. So this, if you can see it, it's what it should look like. And if you can see that, all caps, nice and neat. You can put a comma in between it. Alright, the total charge of $300. If I was doing that, I would do this down here. And you can see $300. Alright, so you kind of get the picture. And then 7 through 10 down there is ask you a few questions. So, and you should answer those. So make sure you do this, because I will ask you technique questions. I'll ask you to, write your name or how it should appear on a claim form on your exam. So make sure you practice those, and we will go over them. Okay, going on to the next part, entering patient and policyholder names. So we're getting into block 2 now. If you want to look at your claim form, you want to separate the last name, the first name, and the middle initial with a comma, just like we talked about. Okay, and it is all in all caps. If you're entering the policyholder's name in block 4, you want to separate the name again with commas and do it all caps. If the patient is the policyholder, you're going to enter their last name, comma, first name, and middle initial. Same thing, separated by commas. You used to just be able to write same in all capital letters, but now this new edition is saying that you're not allowed to do that. You have to basically retype the information. So that may be the new rules now, since more information is being paid attention to with billing and stuff. So make sure you just rewrite the information if it is the same person. Provider names. When you enter the name of a provider on a claim form, you're going to enter their first name, their middle initial, if known, and their last name and their credentials. Okay, and you do not want to use any punctuation. So if I am doing right here at the very bottom on block 31, I'm going to enter their first name, space, middle initial, space, last name, space, and then whatever their credentials are. Okay, so no commas with that. And this is kind of like, even though block 31 it says signature, you're actually just pre-printing their name. Okay, so that's what that is. Flip on over to page 454, mailing address and telephone numbers. When you're doing blocks 5 and 7, let's look at block 5 here. That's the patient's address. Let's see if it's 123 Happy Street. You're going to enter 123 and then all of Happy, capital letters, and then Street. No abbreviations. You have to write it totally out. Okay, all caps. The city and state on line 2, do not do commas, do it in all caps, and then the state can be the 2-letter abbreviation. and then the 5 or the 9-digit zip code. Now, if you do have a 9-digit zip code, you do not put the hyphen after the first 5 digits. You just space and then do the last one. Okay. When you're doing provider's name, mailing address, and telephone number in block 33, which is the very last block on here, you like on line 1, you're going to do the provider's name. So let's say Leslie H. Noles, MD, all caps, no punctuation. The provider's billing address on line 2, and then the third line, the provider's city, state, and zip code. Okay. And then enter the phone number next to the block title, which says 33, and then it has a space right underneath it for phone number. So that's where you'll enter it at. Recovery of funds from responsible payers. Let's go into that part. Basically, this is talking about block 10 on your claim form, which is right here. And usually you're going to X no, no, and no for 10A, 10B, and 10C. This is saying, is the patient's condition related to A, employment? So if it's not workers' comp, we're going to hit no. Is it related to B, auto accident? If it wasn't a wreck or something similar like that, we're going to X no. Was it related to another accident, you know, like a fall at a restaurant or something where somebody else may be paying for it? Then you're going to hit no. So make sure that you X no, no, and no. Now, if we are doing workers' comp or a car wreck, then of course we would put yes there. But that goes into a lot more detail and we have to do that. So right now, they all should be no, no, and no for block 10. Let's see. If you enter an X in any of those boxes, block 10, before the insurance even completes, you know, going through the rest of the claim form, they're going to deny it because they're not going to see intricate detail supplied along with it. So make sure you remember that. Usually it's no, 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 unless they meet one of those 3 guidelines. Okay, the NPI, the National Provider Identifier. This is a 10-digit number issued to the individual providers like physicians, dentists, pharmacists, things of that nature. And these are going to be placed on the claim form. Now you'll see on this one that I gave you, it doesn't show an NPI spot right here, but when you get on yours that I gave you in Angel, it does show NPI after each procedure right here. You do not have to do that one. The only place you have to do in NPI is down here where it says PIN number. That's what it used to be called, was PIN number, but now it's called an NPI. Alright, that's the only place you have to enter it. So the NPI is a 10-digit number, and physicians must have this or they will not be able to file. Okay. If you look on page 455, if the physician needs to apply for it, they can do a web-based application, a paper-based application, or the hospital that they work with can do it for them. Okay, so that's for brand new physicians. Okay, look at the bottom of page 455, practices that bill incident to. So this is like if you have somebody that's like a nurse practitioner or physician's assistant, when the doctor is not there for them to see, then you can do this thing right here. Enter the ordering physician's name in block 17. So 17 is usually one that we will leave blank, but if we have a nurse practitioner, physician assistant, or someone like that that is seeing our patient, then you're going to put the physician's name right in here in block 17. Enter the ordering physician's NPI in 17B. So 17B right here where it says ID source, referring physician, you're going to put the ordering or their supervising physician's NPI number. And then in 24I, you're going to do the physician's NPI number. Yeah, that's the place on this thing. It doesn't, on the one I gave you in class, these are older ones, so it doesn't have a space in I to enter the NPI number, but on the newer ones that I posted you on Angel, it will have a space for that, and you would enter it there. Only, again, only if there's someone other than their physician seeing the patient. And then the supervising physician's name in block 31. And that's what you do when a non-physician person sees the patient. Okay. The next thing, assignment of benefits are versus assignment of benefits and accept assignment. A lot of people do get these confused, so we're going to talk about this. Assignment of benefits, alright, let's look at that. Patient sign block 13 of the claim form. That means that 12 and 13 basically is what they sign right here. Now, you don't physically have to have them sign it. When they are a new patient, they sign a paper at the front desk saying that they agree to let you treat them, or the office treat them, and bill their insurance on their behalf. So all you have to do is type signature on file right here and right here in block 12 and 13. You don't have to put a date, just signature on file. You used to be able to put SOF, but now, right now, they're saying that you have to type out the whole 3 terms. So that's what assignment of benefits means. And then accept assignment. When the yes box in block 27 contains an X, that means the provider agrees to accept assignment. That means that they are agreeing to accept whatever the insurance will pay back to them. Alright, so, and you can see kind of a larger printed version of this. Reporting ICD-9 and ICD-10 codes in block 21, which again, get out your claim form. This is block 21. There's 4 spaces here for 4 diagnoses. If you have more than 4 diagnoses, you're going to have to do another claim form with the rest of them on there. But the very first one that you do should be the first listed diagnosis, what they came in for. You know, if they came in for right knee pain and they ended up having a sprained ligament in the knee, then sprain your ligament in the knee, whatever that code is, should be in the number 1 spot. And then whatever else, you know, fell after will go in the additional areas. Now, just because, you know, they have like 8 chronic diseases does not mean that we have to code those 8 chronic diseases every time. We only code what was discussed and what, you know, what was managed basically at each visit. So that goes in block 21. And if you look at top of page 457, you can see an example. So ICD-9 codes, you know, do have decimals in them. You do not have to put a decimal. You put the first half of it before the decimal, the second, you know, 1 to 2 digits after the decimal. And remember, the first listed diagnosis goes first. And that kind of takes me into the sequencing multiple diagnoses. You have to do the first listed first and then go in order from there. Accurate coding, that's the second thing. We've talked about accurate coding, about not using, you know, probable and rule out this, rule out that, suspected. You have to code the symptoms if that's the case. So this is just a reminder that you cannot code that. You have to go by symptoms, and it has to be recorded in the patient's medical record if you're going to report a condition on the claim form. Okay, now going on to CPT codes on very bottom of page 457. Block 24A is the dates of service, and as I told you a while ago, if you don't want to, if it happens during the same day, let's say, you know, patient came in for office visit, we do not have to put the to date. We can just do the from date and leave the to date empty. If you want to do both dates just to be on the safe side, you certainly can. Alright. Now you want to make sure that the book is kind of a little contradicting here, because I know I told you a while ago for the year that you do need I think you only needed to put the 2-digit year. It will only let you do a 2-digit year when you're doing it electronically there. So if today is April the 8th, 2013, so I would put 04, and then under the day I'd put 08, and then I would put 13 for 13. If it lets you do 4 digits, then yes, do 4 digits. But when I was playing around with your software, I'm pretty sure it only let me do 2 digits there. So if you look on the top of page 458, it kind of shows you an example of that. Then block 24B, the place of service. You need to look in Appendix 2 in the back of your textbook, and there's a big list of a place of service. You need to type you out a cheat sheet that you can use for test purposes that has all the places of service. Meaning, if we're doing a case and it came from the hospital in the emergency room, then it's going to have a specific number attached to it. 11 is the office, medical office, so we are going to use that one most frequently. But you need to go to Appendix 2, and I'll try to flip back here and tell you the page number it's on. And you need to make yourself a little cheat sheet that has all those codes on it. Page 678, the very top part, table 11.1, or table 2.1 basically, has all those codes that you're going to need to know. So you need to type that up or make a copy of half of the page or whatever, but you need to know that. So you won't be asking, well, what's the medical office, what's the hospital, what's the emergency room. So make sure you follow up on that. Block 24C is EMG for emergency. So you would check that, obviously, or X that box if it was an emergency, or you put a Y for yes, or if it wasn't an emergency, you do not have to put an N for no, you just skip it. Alright, so an emergency would be something, obviously, in an emergency room that was like a life-threatening emergency. So you're not going to have that many in a physician's office. Then block 24D, this is where we have to do our actual services. So whatever was first, usually I told you to start with the E&M code first. You're going to list the 5-digit code, and then there's a spot for a modifier if you have one. If you don't, then leave it blank. And then you're going to basically list all your procedures. Then in block E, you're going to put which one of the diagnoses link with that specific CPT code. So we've talked about that quite a bit. So that's what you're going to do there. Let's see, page 460, the charges. You have to do your charges very carefully. You want to do, don't put your $sign in. You want to do, if it's $150 even, then you need to make sure you put $150 on one side of the dotted lines, and then 00 on the other side. Let's see. Let's look on page 462, the National Standard Employer Identifier, which is the EIN number. If I don't give you the EIN number, you can also use the physician's social security number. So make sure you remember that. If an EIN number is not given, you can use the physician's social security number. Okay, and that goes in block 25. So if you look at your claim form, it says Federal Tax ID number. This is the older one. But the new one say, it says, then you have a block. You can either X SSN for Social Security, or you can X EIN. So make sure you tell me what number that is, because a lot of people mess up there. They'll write in the number, but I don't know if it's their social or if it's their EIN. So you need to make sure you tell me which one you're doing. And you need to do it, you know, if it has dashes, you leave the dashes out. It just needs to be one compact number. And if you look at the example it gives you on page 462, it gives you a really good example. Alright, exercise 11-2. I want you to practice before the following Wednesday when we come back to class. So practice filling in that block 24, A through J. Fill it in appropriately, and then we'll go over it. And we'll do the first one together. Alright, on 10/10, October the 10th, we'll say of 2012, we had a 99214. So in block 1, I'm going to put, for the month, I'm going to put 10 for 10. For the day, I'm going to put 10. In the year, I'm going to put 2012, or I'll put 12 for 12. And then I do not have to do the two the 2 day if I don't want to. If you want to, again, you can, but you do not have to. The place of service, well, I just said it was an office visit, so if you look in appendix 2, the place of service for office is 11, so we're going to put 11 there. Was it an emergency? No. It was an office visit, obviously wasn't an emergency, so we leave that blank. CPT code, we did a 99214, so I'm going to put 99214. There was no modifiers with that. Now, what diagnosis is that going to link to? Not sure, it didn't give you the diagnosis there, but anyway, normally if it went with your diagnosis in block 2, then you would put a number 2 there. The charges for the 99214 was $65, so 65 on one side, and the other side of the dotted line is 00. The days are units. This was in 1 day, 1 office visit, so put 1 right there. And then the rest of it, you do not have to do anything, unless for some reason whoever did that office visit was like a nurse practitioner or a PA. Then I would put the primary provider's NPI number there. Otherwise, I would leave that area blank. So do the rest of those, and we'll go over them when we get back to class. Okay, on page 463, we talk about the signature of the physician or the supplier on block 31, which is this one to the far left at the very bottom. You're going to do their first name, their middle initial, and their last name, and then their credentials. Okay, so it needs to again be in all caps. The billing entity in block 33, I will tell you most of the time we're going to skip block 32 because we do not need to fill that out unless, you know, we're billing on behalf of a physician that went to a hospital to, you know, go see a patient, and then we put the hospital's address. Okay, or let's say we're billing for a physician that's in with a big clinic. We'd put the clinic information here, and then in block 33 we would put the physician's information. So that's the difference in that. So the billing entity is whoever the legal business name. So if I work for ABC Family Practice, in block 32 I'm going to put ABC Family Practice, their address, phone number, all that good stuff. Okay, and then 33 I would put Irvin Gooddock MD, again the address, the phone number, the NPI number. Okay, and then exercise 11-3 is completing that block 33, so make sure that you try that as well, and we'll go over that same thing next time we meet in class. Then we're going to talk about secondary claims, and we're almost done. Secondary claims are very similar to your primary claims, except if you look at your claim form, you're going to, let's let me just go by this besides looking at this thing because it's going to confuse me more. But the secondary insurance claim is filed only after you've gotten the remittance advice from the initial claim from the first insurance. Then you can do the secondary insurance. So usually the secondary insurance has to be handwritten or, you know, typed. It can't be filed electronically because that You know, that's just a way that they kind of keep up with if it's, you know, primary or secondary. So what you're going to do in block 11A through 11C, you're going to put an X in the yes box. Is there another, I'm sorry, 11D says, is there another health care plan? And you mark yes for secondary, and it tells you, if yes, return to and complete 9A through D. Otherwise, you do not have to complete 9A through D unless there's a secondary insurance. And then you would fill it out like that. Okay? So if you look on page 464, it shows you a really good example of how that is. Then supplemental plans, example of these is like Medigap for Medicare, and then you have AFLAC for, there's all kind of different AFLAC health plans, and these are supplemental things that cover, you know, smaller funds and fees here and there. So if you have supplemental plans, these will cover like your co-pays and deductibles and things of that nature. Blocks 9A through 9D is usually where supplemental plan information is entered, and that again is kind of the same thing as secondary insurance. Okay, so you can enter that there if you have supplemental. Alright, and let's look at common errors, and you make sure you know these for testing purposes. Common errors, keyboarding errors. We may miscode or, you know, reverse numbers when we're doing procedure or diagnosis coding. We may mess up the policy numbers. We could mess up the dates of service, the federal ID or the EIN number, the total amount. We may miscalculate that. Let's see, incomplete or the incorrect name of the patient or the policy holder. And then, of course, omission meaning you didn't put this. You didn't put the correct diagnosis or the current diagnosis. If you didn't code to the highest level of specificity. The procedure service dates don't link up. The hospital admission and discharge dates, you didn't put those. The name in the NPI of a provider, didn't do those. Required prior treatment authorization numbers. You know, if you're doing, you know, trying to code maybe a CAT scan or an angioplasty, something like that, you would need to put the pre-auth number so the insurance knows that it was pre-authorized. And then you may have left out the units of service. All of those are going to cause the claim to be denied, and then of course you'll have to pay extra money. If you have attachments that do not have the patient and their policy information on it, it can get denied. Failure to align things properly or have, you know, a messy looking claim form, it's going to get you denied. Handwritten items or messages on the claim other than the required signatures, obviously we're going to get denied. Now I know that I'm getting you to handwrite a lot of these now, but I want you to be able to handwrite it and get practice before we start using a computer system to do it. Failure to properly link each procedure with a correct diagnosis. That's majorly important. So the final steps in processing claims is you're going to double check each claim for errors and omissions. You're going to add any necessary attachments. If it's required by the insurance company, you're going to obtain the provider's signature. If not, you can type it in. Post the submission of the claim on the patient's account or ledger. Place a copy of the claim in the claim files, and then submit the claim to the payer. So what you have to do, how we get organized with this, we don't just randomly send and receive stuff. We have to keep like a little tickler file on what we sent, what we've gotten back, you know, what's been taken care of, what's not been taken care of, what's over 30 days, 90 days old. So there's several different files that you have to get set up. And if you look on towards the bottom of page 466, you have 4 different things. You should have an open assigned file, and this is by month. You should have separate files in there by month and by payer. Okay, so I have January through December of opening files, and then I have it by, you know, Blue Cross Blue Shield, TRICARE, etc., etc., Medicare, Medicaid. Then 2, we should have a closed assignment case by year and payer. And then these are ones that have already been paid in full and they're done. Another one, we should have batched remittance advice notes. Okay, we need to keep those. And then 4th, we need to have unassigned or non-participating claims that we use, because those are usually the ones that cause some problems, especially those non-participating providers. And we get to charge a little bit more because the insurance may not pay as much. So those are all the 4 files that you need to have. So make sure you remember that for test purposes. Okay, that's where we're going to stop for there. Now, I've put this on the internet, but I want you to go to Appendix 1 in your textbook, and I want you to print out that form, the CMS 1500 form that I gave you in Angel. I want you to print out 5 copies of it, and I want you to do some case studies. And again, I have them assigned for you on Angel, but you're going to be doing case study... Hold on. I want you to do case study number Appendix 1-2, 1-3, 1-5, 1-6, and 1-10. Those are the 5 that I want you to practice. Now it's easy now because everything's there for you. You don't have to look up any codes. But we will begin that Wednesday when we get finished going over these. We will practice coding from case studies and then filling the claim form out. So it's a little bit more lengthy because you have to actually read a little bit more. So that's what I want you to practice, as well as the 3 or 4 exercises within the chapter, and we'll go over those when we come back the following Wednesday.